And up first this Thursday at 10, one of Springfield's largest employers has fewer employees tonight. Mercy Hospital has announced layoffs as part of a workforce reduction plan to save money.
Color 10 News started hearing about the layoffs from workers yesterday, but it wasn't until today that Mercy confirmed the news. Here's what we know. Mercy says reduced reimbursement from Medicare and Medicaid and increasing labor and drug costs have caused a need for restructuring by reducing targeted positions. We don't know how many employees have lost jobs, but Mercy says the changes affect less than 1% of the system's 45,000 member workforce. We also aren't being told which positions and departments have been affected by the cuts. Our Madison Heaver is live outside Mercy tonight to tell us more about why hospitals turn to laying off workers when restructuring is needed. Madison.
Yeah, Heather, earlier today I spoke with the Missouri Hospital Association, who says, this isn't surprising due to the current healthcare system changing.
Knowing what I know about the announcement there, it is in fact not at all surprising. The pressures on hospitals are intense, and the demand to reorganize is high.
Dave Dillon with the Missouri Hospital Association says when hospitals are looking to restructure, they often lay off workers to start.
More than 50% of the cost of running a hospital is in the employees that work in a hospital. Hospitals are under tremendous financial pressure. Hospitals in Missouri are hurting right now.
We haven't been able to get information from Mercy about which departments are being hit the hardest with layoffs, but Dillon says in a lot of cases it isn't people dealing directly with patient care.
It's not particularly uncommon for hospitals to conduct a reorganization that leads to layoffs, and a lot of those tend to be, the back office people that were in more administrative positions, or in the billing, or in the components for coding.
Dillon says even though some hospitals look like they're expanding and building more locations,
hospitals within hospital systems, even if they look profitable, those hospitals may be subsidizing other hospitals within that system that are actually losing significant amounts of money.
He says health systems have to find a way to balance financial burdens while also providing efficient care.
No hospital organization wants to lay off its staff. On the other hand, no hospital wants to have excessive amounts of cost. It's a matter of striking a balance between how do you run the most efficient operation as far as a hospital operation goes.
And we reached out to Mercy several times to see if they could do an interview, but they just aren't doing any interviews at this time. Back to you guys.
Madison Heaver live tonight. Thanks. We mentioned earlier here in the broadcast, Mercy is citing those lower reimbursement rates from Medicare and Medicaid as part of its decision to reduce its workforce. Of course, Missouri was one of the few states under the Affordable Care Act that chose not to take the federal money and expand Medicaid. Local state Representative Steve Helms believes what led to these layoffs is perhaps a lack of transparency between hospitals and the state with the 2019 budget.
A lot of people that want to expand Medicare and Medicaid for all forget the fact that Medicare and Medicaid are subsidized by private care. And so we've got to figure out a way to do that. And again, I think the best way is through transparency and better consumer-directed approaches.
Helms told Color 10 News he believes the only way to raise Medicaid reimbursement rates is to grow our current economy. Count on Color 10 to stay on this developing story, and once we learn more information, you'll find those details on your phone on our Color 10 News app.